Efforts by health workers to fight the deadly Ebola outbreak continue in earnest in the 3 Ebola-stricken countries. A certain degree of success is being reported. In fact, charity organizations have in the last couple of days said the outbreak appears to be retreating. The United Nations System Coordinator on Ebola has commended the emergency medical response program in the 3 countries.
Let's think a bit about the fact that in some parts we see the outbreak curve starting to come down. That's exactly what we were hoping would happen. And I want to stress to you that just because the outbreak curve starts to come down, we start to see fewer cases in parts of the region, that doesn't mean we can stop. It's quite the reverse. We've seen from earlier information that even a few cases can reignite the outbreak. And so my instructions to everybody, and these are instructions, is stay vigilant, keep up the focus, maintain the drive.
Nabarro, who was appointed in August to lead the UN response to the outbreak, however says there is still a long way before the outbreak can be contained.
Even if we've got a reduction in the rate of increase, this does not mean that the outbreak is under control. And so I would say that the evidence suggests that the strategy that's being pursued is the right one, that we would expect to see a slowing in the rate of increase, but we're still a long way away from being able to say either that the outbreak is under control or, most importantly, that the outbreak has ended. The outbreak ends when the last case of Ebola has been treated, and then it's gone.
Meanwhile, the World Health Organization has updated the Personal Protective Equipment (PPE) guidelines for healthcare workers. These updated guidelines aim to standardize safe and effective PPE options to protect healthcare workers and patients, as well as provide information for procurement of PPE stock in the current Ebola outbreak.
Generally speaking, the guidelines recommend one layer of clothing, one head cover, one gown cover. It does also recommend coveralls plus an apron. That's one place where you may have heavy splashes in your front that it recommends that. And one other place where it recommends more than one layer is on gloves. So explicitly for the first time mentions double gloving as the most appropriate way to go.
WHO says more work is needed to gather scientific experience and data in order to understand why some health workers are infected in the current outbreak and to increase effective clinical care. Susan Mongeli, CCTV.